when you log in, so each user gets their own, username with their email and their password, so they can independently come in at any time and access everything. I will mention that everything that we have is also on an app through the App Store, so they can access all of the issues of evidence-based urgent care. They can watch the EKG and the laceration course as well, all through the app. So you log in and it shows you which products you have, and we'll talk about evidence-based urgent care. So once you sign in, you can scroll through every single issue, and I think what close to 20 issues now, and it really covers, if you look at the topic list, it really covers what we are seeing in urgent care. We talk about pelvic inflammatory disease, orthopedic injuries. I'm just going to list a couple of them: the red eye, skin and soft tissue infections, which I'm actually working on an abscess, incision, and drainage lecture right now. Tick-borne illnesses, dental emergencies. So really a wide variety of clinical topics. So you can click on the full issue. Everything is digital. It's not in print, but they can download it. They can print it off if they want. So if you look at the full issue, it starts off, it gives an abstract. Every single issue has a few case presentations that really, mirror the things that we're seeing in the clinic. And then at the very end, it has a case resolution and it talks about those and kind of wraps them up. So you get your basics, the introduction, pathophysiology, lots of tables, charts, graphs, images. Again, these things can be copied and pasted and put into your own lectures if you would like to utilize. And a lot of the groups that we work with, in fact, do this. They take evidence-based urgent care and create their own monthly journal club. So instead of you having to spend 20 hours to put a journal club together, it's already done for you, and everybody has access to the monthly issue. So it goes through, we talk about differential diagnosis. Another thing are these three words right here. Everything in urgent care has been historically either emergency medicine or family medicine based. And this is the first issue or first journal of its kind that is really targeting and specific to urgent care medicine. A lot of these issues have been adapted from the emergency medicine side, but they're all edited and peer reviewed by practicing urgent care clinicians. So this is very relevant to your team. Of course, the physical exam, diagnostic studies, we understand that CT and MRI and ultrasound is not readily available. So we're not asking people to order those things because we know that it's not really an option. Also limited laboratory evaluations in the urgent care setting. Then of course the treatment, specific, special populations, things like that. And then cutting edge controversies, all these things are included in every single issue. Then we talk about the disposition, knowing that we can't admit patients from urgent care and whether or not a patient needs to be transferred to the emergency department. You get your summary. And then the things that we're supposed to know, but never really get taught, how to be more time and cost effective. There's a little tidbit on things specific to children. And then here, before I was a partner, I was a subscriber, and I always have enjoyed going through and looking at the risk management pitfalls because none of us want to get that conversation. Hey, you remember that patient you saw last week? Because we know where that's going. So these really are a great component of the journal, and they can also lead to good discussions. And for you all with your compliance talks, but also just at the bedside, you're talking with one of your clinicians. Hey, let's talk about some of these things. How can we prevent some of these bad outcomes that we're seeing? And then you see the case conclusions, the coding and charting that we've talked about, and a pretty good summary of what you need to look for and kind of an in-depth dive into the billing and coding aspects for that particular clinical entity. And then you've got your coding challenge. Another thing that a lot of the groups like are the clinical pathways, because these too can be copied, pasted, printed off for everybody to have reference to so that you can standardize a lot of the clinical practices and really trying to get everybody on the same page practicing, hopefully in a similar evidence-based manner. And then, of course, everything is heavily referenced. Here we've got, let's see here, keep scrolling down, 145 references. So you can see that this is really an in-depth dive into each topic, and it's all, again, evidence-based. So that is a deep dive into one issue of evidence-based urgent care